Welcome to the deep dive. Today we're focusing on something pretty striking you might see in your dog or cat. Blood inside the colored part of their eye.
Mm-hmm.
Medically, it's called hyphema. And we're going to explore, what that blood means, why it shows up,
Yeah.
and what it could be telling us about your pet's overall health. We've got some great veterinary insights to help us understand this.
Exactly. And what's key to understand, really right off the bat, is that while seeing blood in your pet's eye can be, well, alarming,
Yeah, happened a lot.
the hyphema itself usually isn't painful. Think of it more like a red flag or really visible signal that something else might be going on that needs our attention.
Okay, so it's a sign. We see this blood. What exactly is happening inside the eye then?
So simply put, hyphema is just the presence of blood in the anterior chamber of the eye.
The anterior chamber, that's the front part.
Yeah, exactly. That's the space right at the front between the clear window, the cornea, and the colored part, the iris.
Mhm.
And the lens sits behind that. Now, this blood isn't always, uniform. You might see a distinct clot.
Okay.
Or if the pet has been still for a while, the blood might actually settle at the bottom, kind of like sediment.
Right.
Another appearance is what's often called cherry Kool-Aid, which is a pretty vivid description.
Yeah. Unsettling but vivid.
Right. That's where the red blood cells are just suspended, mixed throughout the fluid in there, giving the whole front of the eye this reddish tint.
Cherry Kool-Aid.
Mhm.
Okay, so how does that blood even get into that space? What's the mechanism behind hyphema?
Generally, it happens because the normal barrier that keeps blood out of the anterior chamber, we call it the blood aqueous barrier,
Mm-hmm.
that barrier gets compromised somehow, or there's direct damage to the tiny blood vessels in the iris and the ciliary body that's part of the structure that makes the fluid inside the eye.
Okay, so like a leak.
Yeah, kind of. Imagine that barrier as a really strict border control.
Right.
When it breaks down, or let's say the pipes, the blood vessels get damaged, blood can leak into that space where it shouldn't be.
Okay, so the
Yeah.
Border Patrol is weakened, or there's a leak in the plumbing, basically. What could cause that to happen? Our info points to a few possibilities.
Right. So direct injury to the eye is a big one.
Like bumping into things.
Yeah, anything from bumping into furniture to, more serious trauma, that can physically tear those small blood vessels.
Makes sense.
And interestingly, the body's own inflammatory response can also play a role.
How so?
Well, when there's an injury or even an infection, the body releases these substances called prostaglandins.
Okay.
Think of them like little chemical messengers that kind of stir things up when there's damage. And in the eye, they can make that natural barrier, well, a bit too leaky.
Okay. So injury leads to inflammation. The inflammation triggers these messengers, and that can cause the bleeding.
Exactly. That's one pathway.
What else could be going on?
We also have to think about direct damage to the walls of the blood vessels themselves. This can happen with conditions like systemic hypertension, just high blood pressure.
Right. Like in people.
Exactly. Or even due to abnormal immune responses where the body's own defense systems mistakenly attack the blood vessel walls.
Wow.
Even circulating things like infections or cancer cells can directly damage these really delicate structures.
So it's not just about the vessels leaking, but sometimes they're actually attacked or damaged directly.
Correct. And this is important. Anything that prevents the blood from clotting normally.
Like a bleeding disorder.
Precisely. Like having a low platelet count. Platelets are like the tiny construction workers that plug leaks in blood vessels.
Right.
Or other clotting factor deficiencies. If you don't have enough of those workers or the right materials, even minor damage can cause more significant bleeding.
So it's not always a direct hit to the eye then. Sometimes it's really a symptom of something happening elsewhere in the body.
Absolutely. And here's where it gets really interesting, actually. The growth of abnormal new blood vessels inside the eye is a really significant factor.
New blood vessels, why would they grow there?
Well, the most common reason is the development of something called pre-irital fibrovascular membranes, or PIFMs for short.
PIFMs, okay.
Yeah. Imagine these tiny, really fragile spider webs of blood vessels growing on the surface of the iris where they shouldn't be. And because they're so fragile.
They bleed easily.
Exactly. They're very prone to bleeding. And these often form as a response to long-term eye problems.
Like what kind of problems?
Things like chronic uveitis, that's inflammation inside the eye, or a detached retina, glaucoma, even tumors within the eye can trigger this PIFM formation.
Huh. So a long-standing eye issue can cause these weak vessels to grow, which then bleed, leading to hyphema.
That's Yeah, that's an important link for people whose pets have ongoing eye conditions.
It really is.
Mhm.
And then much more rarely, hyphema can happen because of bleeding from blood vessels that were supposed to disappear after development but didn't.
Like birth defects. Sort of, yeah. Congenital issues. Things like persistent pupillary membranes, little strands across the pupil, or remnants of the blood supply that nourished the lens when it was developing.
Okay, so we've got a handle on what hyphema is and the different ways it can happen, both from eye-specific things and as a sign of bigger bodily issues.
Yeah.
Why is it so critical that we pay attention if we see this in our pets?
Because, like we touched on earlier, hyphema can very often be the first sign, sometimes the only visible sign, of a really serious underlying systemic disease.
Right.
Ignoring it, maybe thinking, it's just a little blood, it'll clear up, could mean missing a crucial chance to diagnose and treat something potentially life-threatening.
Okay.
So this symptom, even though it's just in the eye, can be incredibly important for their overall health.
That definitely highlights the need for action.
Yeah.
Let's dig into those specific potential causes a bit more. Our sources seem to split them into primary ophthalmic, starting in the eye, and systemic related to the whole body. Let's tackle the eye-related ones first.
Sure. So for primary eye causes, trauma is a major one, as we said, blunt force or even perforating injuries where something actually punctures the eye.
Okay.
And interestingly, something like extraocular vascular compression,
What's that?
like maybe from a collar that's too tight or even significant pressure on the chest
Yeah.
that can temporarily spike the blood pressure in the head and actually cause bleeding inside the eye.
Wow. Really? From a tight collar? That's
uh,
not something you'd immediately think of connecting to bleeding in the eye.
Definitely not. It's less common, but possible. Then we have those PIFMs we just talked about, those fragile membranes.
Right.
A retinal detachment itself can sometimes cause bleeding into the front chamber.
Okay.
And of course, primary intraocular neoplasia, basically tumors starting in the eye. Things like iris melanomas or ciliary body tumor.
Cancers.
Yes. And also metastatic neoplasia cancer that spreads to the eye from somewhere else in the body. Lymphoma is a common one that does that. There's also a specific inflammatory condition mostly seen in golden retrievers called pigmentary uveitis that can lead to hyphema.
Specific to Goldens.
Yeah.
Interesting.
Yeah. And finally, those rare congenital blood vessel issues we mentioned, things that didn't form quite right.
That's quite a list just for eye-related triggers.
Yeah.
Now, let's shift to the systemic diseases. What kind of whole-body health problems can show up as blood in the eye?
Yeah, this is where you really see how interconnected everything is. Systemic hypertension, high blood pressure is a big one.
Yeah.
Conditions that cause hyperviscosity syndrome, basically, where the blood gets too thick and sludgy.
Right, doesn't flow well.
Exactly, that can be a factor. We already mentioned thrombocytopenia, low platelets, and other clotting disorders. Certain infectious diseases are definitely implicated too, things like rickettsial diseases.
Like from ticks.
Often, yes, like Ehrlichia or Rocky Mountain spotted fever. Also, feline infectious peritonitis, FIP.
Oh yeah, FIP is devastating.
It is. And certain fungal infections like protozoa, even parasites where larvae sometimes migrate aberrantly into the eye.
Parasite larva in the eye. Yikes.
Yeah, it happens. Not common, but it's on the list. FIP and fungal diseases, as you noted, can affect multiple body systems, so seeing signs in the eye fits their pattern.
It really underscores that the eye can be a window to the rest of the body's health.
It absolutely can be. And it's worth remembering, too, that some breeds might just be more prone to certain eye conditions that could lead to hyphema.
Like you mentioned, the Goldens.
Right, and collies with collie eye anomaly, for instance, have specific vulnerabilities.
Okay, so if an owner spots this blood in their pet's eye, what clues from the pet's history or from a vet's exam might help pinpoint the cause?
History is super helpful. If the hyphema pops up suddenly in just one eye and the animal seems fine otherwise, that might lean more towards a primary eye issue, like maybe some unreported trauma. Did they run into something? Did they play rough?
Right.
But if the hyphema is in both eyes, or if the pet is also showing other signs like weight loss, not eating well, being lethargic, maybe acting like they can't see well, then a systemic cause shoots way up the list of possibilities.
And pain. Does that give clues?
Yes, definitely. If the eye also seems painful, that often points towards inflammation, maybe from an infection or uveitis, or potentially a tumor inside the eye causing problems.
Okay. And what about the actual physical examination? What might a vet look for?
Well, for those primary eye causes, unless it was part of a major whole-body trauma, the abnormalities might really be just around the eye itself.
Like swelling.
Yeah, with blunt trauma, you might see painful swelling, maybe even signs suggesting an orbital fracture, a broken bone around the eye socket. The hyphema in those cases is often total, filling the whole chamber.
And if something punctured the eye, perforating trauma.
That's usually more obvious. Often severe pain, discharge that could be bloody or clear. The pupil might be really small, constricted. You might see changes to the shape of the front chamber, swelling in the cornea around the puncture site. Maybe even the iris sticking out.
Oof. Sounds nasty.
It can be. Now, hyphema from those fragile PIFMs, or maybe a retinal detachment or a tumor, that might actually be less painful initially. Fewer obvious signs of inflammation.
Interesting.
And sometimes seeing a really advanced cloudy cataract might make the vet suspicious of underlying PIFMs or retinal detachment as the root cause.
Okay. And for the systemic causes, what would the exam findings look like then? Must be more varied.
Hugely varied, absolutely. A really thorough general physical exam is key. Depending on the disease, the rest of the exam might be totally normal.
Really?
Yeah, especially early on. Or it could reveal big things like enlarged lymph nodes, maybe a heart murmur, pale gums, you name it.
Okay.
When we look specifically at the eyes in cases of non-inflammatory systemic stuff like high blood pressure or clotting issues,
Yeah.
there might be minimal discomfort, not much inflammation signs like flare or constricted pupil. But high blood pressure very commonly causes bleeding in the back of the eye, on the retina, or even retinal detachment.
Okay. So you look at the front and back.
Always. Clotting problems might show up as bleeding elsewhere too, like under the conjunctiva, the white parts covering, or even behind the eyeball itself, making it bulge. Low platelets might cause tiny little pinpoint hemorrhages, called petechia, on the conjunctiva.
And if it's infectious or cancer-related?
Then you often do see significant pain and inflammation inside the eye we call anterior uveitis. So a constricted pupil, that cloudy flare in the fluid, maybe fibrin strands, a red or swollen iris.
Right.
You might also see signs of inflammation in the back of the eye, maybe retinal detachment there too, and possibly even secondary glaucoma, high pressure.
So, yeah, the whole picture, not just the bloody eye itself, is absolutely critical for diagnosis. Now, our info mentioned it can sometimes be tricky to tell hyphema apart from something called deep corneal vascularization. What's that about?
That's a good point. Sometimes what looks like blood pooled in the eye, especially maybe along the bottom edge of the cornea, it might actually be a dense network of new blood vessels that have grown into the cornea itself.
Okay. Not in the fluid, but in the window.
Exactly. It's usually a response to chronic irritation or ulcers on the cornea. A careful exam, usually with magnification and good light, can tell the difference. Hyphema blood is free-floating or settled in the chamber, while these vessels are fixed like little red threads within the corneal tissue.
Gotcha. So once hyphema is confirmed, what diagnostics might a vet run to figure out the why?
Well, baseline blood work is usually the first step. A CBC complete blood count, a biochemistry profile, and a urinalysis.
Standard stuff.
Yeah, it gives a broad overview. It can point towards infection, inflammation, organ issues, anemia, lots of clues.
Okay.
Then, depending on what the history and exam suggest, you might need more specific tests. If we suspect a bleeding issue, a clotting profile is needed.
Makes sense.
If infectious disease is high on the list, specific blood tests, serology or PCR for things like tick-borne diseases or fungal infections might be run.
Right.
And a really important tool if we can't see the back of the eye clearly because of all the blood. An ocular ultrasound is fantastic. It lets us look through the blood, essentially, to check the retina for detachments or tears, and look for any masses or tumors back there.
Ultrasound for the eye. Cool.
Very useful. And depending on suspicion for a systemic disease, chest x-rays, abdominal x-rays, or ultrasound might be next, looking for tumors, signs of infection, organ changes.
Okay.
If we suspect high blood pressure, measuring it is crucial, usually with a Doppler device.
Like they use for people.
Exactly. And if lymph nodes are enlarged or we're worried about cancer, maybe a fungal infection spreading, taking a small needle sample and aspirate from a lymph node for analysis can be really helpful.
So it could be quite a workup, a real investigation.
It often is, yeah, because finding that underlying cause is paramount.
Okay, so let's say a cause is found, or even while you're looking. What about treatment? How is the hyphema itself managed?
In most cases, the initial care can happen on an outpatient basis, so at home, unless, of course, the underlying systemic disease is so severe it requires hospitalization for intensive therapy. Activity restriction is usually a good idea.
Keep them quiet.
Yeah, especially if their vision is poor or if they definitely have a bleeding disorder. You want to avoid rough play or anything that could cause more bleeding.
Makes sense.
And client education is huge here, explaining that the blood itself isn't usually the painful part, but finding and treating the cause, plus treating the eye to prevent complications, that's critical. We want to avoid things like secondary glaucoma and blindness down the road.
Our information mentions surgery sometimes, but interestingly, not usually to just remove the blood. Why not?
That's right. Going in surgically just to flush out the blood from the anterior chamber, it's generally not recommended
Oh,
because the surgery itself can often stir up more inflammation and even cause more bleeding, so you can make things worse.
yeah.
Now, if the hyphema happened because of a perforating injury, something punctured the cornea, then surgery is often needed, but it's to repair the hole, to suture the cornea, or maybe place a graft, to try and save the eye's structure and hopefully vision.
Got it. So surgery for the cause of the bleeding, like a hole, but not the blood itself.
Generally, yes. And sadly, in cases where the eye is really severely damaged, clearly permanently blind and painful, then removing the eye, enucleation, is often the kindest and best option for the animal's quality of life.
Right. What about medications? What's the approach there?
Meds have a few goals. Stabilize that leaky blood aqueous barrier, reduce inflammation inside the eye, prevent complications like the iris sticking down, and of course, treat whatever underlying systemic cause has been identified.
So what kind of meds? Eye drops.
Often, yes. Topical steroid eye drops, things like prednisolone acetate or dexamethasone, are frequently used. They're great for calming inflammation and stabilizing that barrier. Big but, they absolutely cannot be used if there's a corneal ulcer or a perforation. Steroids can make those much worse.
Okay, crucial point. What else?
Atropine eye drops might be used. They dilate the pupil, which helps prevent the iris from scarring down onto the lens behind it that's called posterior synechia. But again, a contraindication. You don't use atropine if the pet has developed secondary glaucoma because dilating the pupil can make the pressure worse in that situation.
So lots of checks and balances.
Definitely. Then you might use systemic meds too. NSAIDs, non-steroidal anti-inflammatories given by mouth or injection, can help with pain and also help stabilize that blood aqueous barrier, especially after penetrating trauma.
Okay.
Systemic steroids like prednisone might be used for certain underlying immune conditions or inflammation in the back of the eye, but you have to be careful, especially if infection is suspected. You'd need appropriate antibiotics or antifungals on board too.
Right.
And if secondary glaucoma does develop that increased eye pressure, then specific topical glaucoma medications are essential to try and bring the pressure down. Things like carbonic anhydrase inhibitors or beta blockers.
Are there any medications that are definite no-nos with Hyphema?
Yes. Topical NSAID eye drops are generally avoided. And certain types of glaucoma drops, the prostaglandin analogs, are usually contraindicated if the glaucoma is secondary to this kind of inflammation.
Good to know. And follow-up. How closely do these pets need to be watched?
Regular follow-up is really important. The main reason is to monitor for secondary glaucoma.
Checking the pressure.
Exactly. Using tonometry to measure the intraocular pressure. Glaucoma can sneak up and cause irreversible blindness quickly, so catching it early is key.
How often?
The frequency really depends on the initial pressure, the severity of the hyphema, and other risk factors. It might be very frequent at first, then spaced out, but obviously you can't do tonometry if there's still an open corneal perforation.
Right, of course. So what are the main complications we're trying to avoid or manage here?
Secondary glaucoma is the big one. We've also mentioned posterior synechia, the iris sticking down. Cataract formation can also happen as a consequence of the inflammation or the underlying disease.
And the worst outcomes.
Significant permanent vision loss, and potentially the need to remove the eye altogether if it becomes persistently painful and blind.
Okay. So wrapping this part up, what's the general prognosis? What can people expect if their pet develops hyphema?
It really hinges on the underlying cause and how much damage occurred inside the eye initially.
Makes sense.
If you can find and successfully treat the underlying cause, say, get the high blood pressure under control, or treat the infection and the internal eye structures aren't too badly messed up, then the chances of the hyphema resolving and the pet keeping good vision can be quite good.
That's encouraging.
But if the initial trauma was really severe, or if the underlying systemic disease just can't be controlled, then the prognosis is poor. The hyphema might persist or keep coming back, and blindness is a real risk.
What are those PIFMs?
Yeah, hyphema caused by those pre-irital fibrovascular membranes can be frustrating. It often doesn't resolve completely, or it recurs because those vessels are just inherently leaky.
Right.
And again, for any eye that ends up being persistently painful and blind, regardless of the cause, enucleation removal is often the recommended course for the animal's comfort.
So bringing it all together,
Mm.
that really striking sight of blood in your pet's eye, while maybe not causing obvious discomfort itself,
Mm-hmm.
is very often a really important signal, a signpost, like you said, pointing towards potentially something significant going on,
Mm.
either just in the eye or maybe a bigger issue affecting their whole body.
Exactly right. The bottom line is, if you see this in your pet, getting them to a veterinarian promptly is absolutely crucial. Don't wait and see.
All right.
Identifying that root cause is the first and most vital step towards getting them the right treatment and hopefully preventing those more serious consequences like blindness or eye loss.
And for those listening who might want to dig a bit deeper, maybe look into some of those specific conditions we mentioned, like PIFMs or FIP, or maybe rickettsial diseases. But understanding the context of those diseases can give you even more insight into just how complex eye health is in our animals and how it connects to everything else.
Absolutely. And it kind of raises a broader point for us to think about, doesn't it?
Yeah.
What other seemingly small, isolated symptoms in our pets might actually be connected to these larger underlying health stories?
That's a great point.
It's just a good reminder that our pets often tell us things in subtle ways, things that might seem insignificant at first glance. And our careful observation as their caregivers is just so, so important.